Good morning, students. Today we will discuss about the anatomy of the posterior triangle. Whenever we are studying any triangle, study that in under the following headings. That is the boundary of the triangle, the structures forming the roof of the triangle, structures forming the floor of the triangle, and the important contents of that triangle. So the posterior triangle is a triangular space on the side of the neck and it lies behind the sternocleidomastoid muscle. This is the sternocleidomastoid muscle. So behind this muscle there is a triangular space on the side of neck which is referred to as the posterior triangle of neck. The boundaries of this triangle, this is the anterior border of sternocleidomastoid. This is the posterior border of the sternocleidomastoid. This muscle is the trapezius muscle. This is the anterior border of the trapezius muscle. So, the anterior boundary of the triangle is formed by the posterior border of the sternocleidomastoid, and the posterior boundary of the triangle is formed by the anterior border of the trapezius muscle. The apex of the posterior triangle is formed where the two muscles meet, and the point where the two muscles meet and lie is the superior nuchal line. So the apex lies on the superior nuchal line where the trapezius and the sternocleidomastoid meet. The base or the inferior boundary is formed by middle 1/3 of the clavicle. Same is presented here in this table, the boundaries of the posterior triangle. This figure also describing the boundaries of the posterior triangle, that is the apex formed by the meeting point of the two muscles. The base is formed by the middle 1/3 of the clavicle. This is the posterior border of the sternocleido, which is forming the anterior boundary of the triangle. This is the posterior boundary, which is formed by anterior border of the trapezius. This is norma occipitalis, and you have the superior and inferior nuchal lines. On the superior nuchal line, you also have in the lateral half, you also have the insertion of the sternocleidomastoid muscle, as well as the apex of the posterior triangle also lies on the superior nuchal line. Roof of the posterior triangle is formed by the deep cervical fascia, that is the investing layer. The very first layer forms the roof of the posterior triangle. In this figure, you can see the boundaries, or these are the boundaries of the investing layer of deep cervical fascia. The superficial fascia present over the posterior triangle contains these following structures. It contains the muscle, that is platysma, the most superficial muscle, vein, that is the external jugular and the posterior external jugular, nerves like supraclavicular, great auricular, transverse cutaneous, lesser occipital. All these four nerves are the branches of the cervical plexus. They are also the content of the posterior triangle, as well as part of these nerves also contribute, or also they are lying into the superficial fascia of the roof of this triangle. So these are the cutaneous nerves, the branches of cervical plexus. Part of these nerves they are present into the superficial fascia of the roof, and part of them form the content of this triangle. This is the external jugular vein that also is present in the superficial fascia of the roof. The roof also contains some branches from the arteries, that is suprascapular, occipital, and transverse cervical. And there are lymph nodes, there are lymph vessels. These lymph vessels from the roof, they pierce the deep fascia and they end in the supraclavicular group of lymph nodes. So this is the investing layer of the deep cervical fascia which forms the roof. Also you can see these structures, they are contained into the superficial fascia. This is external jugular vein. These are the cutaneous branches. This muscle is the platysma muscle, the superficial muscle. Floor of the triangle is formed by another layer of the deep cervical fascia, which is the prevertebral layer, a layer just in front of the vertebral column. That is why it is known as prevertebral layer. It forms the floor and it gives covering to all these four muscles. These four muscles form the floor of the posterior triangle, and these muscles are covered by the prevertebral layer of the deep cervical fascia. So the muscles are semispinalis capitis, splenius capitis, levator scapulae, and scalenus medius. So these are the superficial and the deep group of muscles of the back, especially the muscles of the neck region. They contribute, part of these muscles contribute in the formation of the posterior triangle of the neck. Now this posterior triangle of the neck is divided into two parts, and that division is made possible by one of the infrahyoid group of muscles, that is the omohyoid, which we will also study in detail. But this muscle basically has two bellies, that is superior belly and inferior belly. So the inferior belly divides the posterior triangle in two parts. So you can see in the figure here, this entire is the posterior triangle, and this you can see a larger green portion and a smaller red portion. So these two portions are divided by this muscle. This is the omohyoid muscle, this is the superior belly, and this is the inferior belly. So inferior belly divides it into a larger part, upper part, which is the occipital triangle, and a smaller lower part, which is the subclavian triangle, or it is also known as supraclavicular. Because it is present just above the clavicle, it is known as supraclavicular, and because this triangle contains part of the subclavian artery and vein, so it is known as subclavian triangle. Contents, we will study the contents of the posterior triangle, and the contents are divisible into contents of the occipital triangle and contents of the subclavian triangle. So contents, or the most important content of the occipital triangle, is the spinal accessory nerve. So it contains many nerves like spinal accessory, branches or roots of the brachial plexus, that is C5 and C6. It also contains the four cutaneous branches of the cervical plexus, that is lesser occipital, great auricular, transverse cutaneous, and supraclavicular. In order to remember them, you have a mnemonic G last. This figure is showing these cutaneous branches and especially the spinal accessory nerve. Again, all the cutaneous branches are shown in this figure also, the greater auricular, the lesser occipital. This is the spinal accessory nerve, just in the middle. This is the transverse cervical. Few branches are also given to muscles. That is, there's a mnemonic let's take rest, where L stands for levator scapulae. So two small branches from C3 and C4 go to this muscle. T stands for trapezius, branches also for the trapezius muscle, and R for nerve to rhomboids. Other contents of the occipital triangle, because it is occipital triangle, so it contains the occipital artery and it contains the occipital nodes. And it also contains the supraclavicular nodes and then the transverse cervical artery and vein. As it contains transverse cutaneous nerve, it also contains a transverse cervical artery as well as a vein. So again, the figure is showing contents of the occipital triangle. That is, you have the occipital artery, you have all the important one is the spinal accessory nerve, the cutaneous nerves, and the lymph nodes. So mainly the triangle contains artery, lymph nodes, and nerves. In the subclavian triangle, the contents are, again it also contains nerves, arteries, and lymph nodes only. So the nerves are, it contains roots and trunks of the brachial plexus, and also nerve to serratus anterior, nerve to subclavius, and the suprascapular nerve. So because all these muscles somewhere are close to this triangle, the serratus anterior and the subclavius, all these muscles are close to this region. So you have the nerves supplying these muscles and they are present, they are lying inside the subclavian triangle. So this smaller one, lower one is the subclavian triangle. You can see the subclavian artery, subclavian vein, the supraclavicular lymph nodes. You can see all the small nerves. Also part of the external jugular vein lies. Also you have the transverse cervical artery and vein are also present. That is the commencement, that is the beginning of the transverse cervical artery. You can see here the beginning of the transverse cervical artery is present in the subclavian triangle, and also the termination of the vein. So this is the transverse cervical vein, which also lies in the occipital triangle, but it ends into the subclavian triangle. It ends into the external jugular vein, and the lower part of the external jugular vein also lies in the subclavian triangle. So nerves, then the vessels is the subclavian artery and subclavian vein, especially the third part, the suprascapular artery and vein. It also contains the suprascapular nerve, and it also contains suprascapular artery and vein. Commencement of transverse cervical artery, termination of corresponding vein, lower part of the external jugular vein. And you have lymph nodes, that is the supraclavicular group of lymph nodes. So whether it is the occipital triangle or the subclavian triangle, both contain nerves, arteries, lymph nodes. Their name would change according to the triangles, and they are mostly either brachial plexus is giving the roots and trunks, or the cervical plexus is giving the cutaneous branches. And clinical condition, most important clinical condition which is associated with this posterior triangle is, as it contains lymph nodes, and the lymph node, the group is supraclavicular lymph nodes. So the most common swelling in the posterior triangle is because of these lymph nodes. Any surgery, any if in certain cases, if we have to take the biopsy of the lymph node, care must always be taken to preserve the spinal accessory nerve, whether it is any surgery that is being done or it is any biopsy that is being taken from these lymph nodes, or we are going for a block dissection of neck in case of malignancy. Always care must be taken to preserve, to not injure the spinal accessory nerve, as this nerve may get entangled amongst these enlarged lymph nodes. Lymph nodes are commonly enlarged in different conditions like tuberculosis, Hodgkin's disease, and malignant growths. Hodgkin's is also a type of a lymphoma only. And malignant growths from the breast, arm, and the chest may also lead to swelling of the supraclavicular nodes. So that's all about the posterior triangle of the neck. Thank you so much.